In this presentation, we will go through the movements of riding a bike and list the importance of the structures that play a role in not only the lower body, but the upper body as well. Starting with the lower body, while being in this position on the bike, the pelvis, which is the beginning of the lower complex, plays a large role. The pelvis is comprised of the ilium, ischium, pubis, coccyx, and sacrum bones, as well as the ischiotuberosities, also known as the sitting bones, since this is where the three hamstring muscles originate. While in this position, we have 3 points of contact to the bike: the pelvis on the seat, the hands on the handles, and the feet on the pedals. In this picture, Ryan begins with his right foot in a neutral position and the left foot is slightly plantar flexed. As you can see, he has right knee flexion of about 90 degrees due to the concentric contraction of the hamstring muscle group and eccentric lengthening of the quadriceps group. While the quadriceps are working, the gluteus maximus is also being worked. The hip is flexed, concentrically shortened by the iliopsoas, rectus femoris, and pectineus. The rectus femoris is one of the 4 quadricep muscles, but it is the only one that crosses the knee and the hip. In this picture, Ryan's left foot is slightly plantar flexed due to the peroneus longus and brevis muscles. His left knee has a concentric contraction of the hamstring group and eccentric lengthening of the quadriceps group. While it is hard to see in this picture, the right hip is extended, forcing the lengthening of the hip flexors while contracting the gluteus maximus, and his right foot is plantar flexed. While the main role of the hamstrings is causing the knee flexion, they also help assist in hip extension as well. His left hip is in flexion, concentrically contracted by the iliopsoas, eccentrically by the 3 hamstring muscles, the semimembranous, semitendinosus, and the biceps femoris, which are 2 joint muscles. In this phase, his body is positioned in the most upright position out of them all. While being in this position, his right ankle is in a neutral position, while his left ankle is in slight plantar flexion. Both of his knees are in flexion due to the concentric contraction of the hamstrings and eccentric contraction of the quadriceps. His pelvis is slightly anteriorly rotated in this position on the bike. Moving on to the upper body, Ryan decided to keep his backpack on, which is full of all of his learning books, in order to force his posture to compensate for the weight. This was done to demonstrate that muscles are actively working despite the fact that we are not always consciously aware of it. Since the body is a kinetic chain, the use of one muscle group will affect the one above and below in some type of fashion. Starting from the top, the deep cervical muscles that produce flexion active in this position would be the longus capitis, longus crevis, which consists of 3 portions: the superior oblique, the inferior oblique, and vertical, the rectus capitis anterior, and the rectus capitis lateralis. Anteriorly, the pectoralis major is relatively contracting since Ryan's arms are extended in front of him in a sagittal plane and slightly adducting. This is due to the distal attachment of both heads into the intertubercular sulcus of the humerus. Of the pectoralis major portion, the clavicular head is going to be more significant than the sternal portion in this concentric contraction. However, the pectoralis minor will be utilized much more in this position since it originates from the 3rd through the 5th ribs and inserts into the coracoid process of the scapula. Then the serratus anterior will also be concentrically activated as it assists in the protraction of the scapula. Next, all 3 paraspinal muscles, which consist of the iliocostals, longissimus, and spinalis, are eccentrically contracting as Ryan is leaning forward to counteract the weight of the backpack. Though it is uncommon to wear a backpack while riding a bike, it is important to note that both the rhomboid minor and major are not activated at all, as this can cause rounded shoulders. The frequent position of wearing a heavy backpack will indirectly cause them to become weak, which will lead to a tight pectineus minor, thus leading to a cascade of negative events in the kinetic chain. For example, thoracic outlet syndrome can be caused from a tightening of the pectoralis minor since it runs over the subclavian artery and vein, as well as the brachial plexus originating from C5 to T1. Next, we will talk about a neglected region of the anatomy that plays a significant role in this process. The thoracolumbar fascia is a tough membrane composed of 3 layers that cover the deep muscles beneath the back, covering the thoracic spine. Muscles are also enclosed within these layers. This fascia tissue covers the entire lower back area, and it connects from the shoulder to the opposite hip. The connection that the thoracolumbar fascia has with the posterior ligaments of the lumbar spine allows it to assist in supporting the vertebral column when it is flexed by developing fascial tension that helps control the abdominal wall. In particular, these authors have proposed that the gluteus maximus and the latissimus dorsi, two of the largest muscles of the body, contribute to coordinating the contralateral pendulum-like motions of the upper and lower limbs. This happens because of the shared attachment to the posterior layer of the thoracolumbar fascia. By looking at this picture, you can visualize each muscle and what its action is. You can also use this as a clock to see which muscles you are working at different points of the rotation during pedaling. So as you've seen here, there are many muscles that contribute to being able to ride a bike. However, two muscles that actually do not add much power to the legs are the gastrocnemius and the soleus. For these muscles to play such a big part in the lower leg, they don't provide much power. They are utilized mainly to stabilize the lower portion of the leg.